Good morning, everybody. This is Rolando Miewiczyrus. Welcome to Dr. Tom's Tips on Tuesday at 10 o'clock. So when you look at it, the purpose of this is to give people feedback and some tips on using the Isolite. When you look at it, the topic today we're going to cover is related to hard to reach areas inside the mouth when you're using the Isolite. A bunch of people have come to us and they've said, I run into difficulty gaining access inside the mouth, especially from the lingual aspect of during my procedures. Dr. Hirsch, what tips would you give people regarding how to deal with that and different ways to navigate that inside the mouth with Isolite?
Good morning, Rolando. Good morning, everybody. Welcome once again to Tom's Tips at 10. We're working through this COVID thing, and so we're going to continue to do that. Great question. We are always looking for more room to work in the mouth. I mean, we want to sit down there and be able to have great access everywhere. One of the biggest challenges that we have is the tongue is in the way, so that's why we stick the Isolite in the mouth to keep that tongue out of the way. When we do that, we are compromising space. When the Isolite is not in the mouth, we have an assistant that is in there with a mirror, with a HVE hose. We've got our handpiece, we've got our mirror, so there's a lot of compromise there. So just by putting in the Isolite, we're eliminating two hands out of the mouth. So number one, that automatically gives us more room, but sometimes the room that gives us isn't enough. So we've got complications, we've got the tongue, we got to get that out of the way, and we've got the Isolite in the mouth. And so as we look at the Isolite here, as I place this in the mouth, of course, the cheek would be bringing this around forward. As we place this in the mouth,
there you go.
You can see that the Isolite keeps it out of the way. But there's an issue there with that tongue protector being in the way. So one of the things that I always like to do before I start working on a patient is, where am I working in the mouth? If I'm working in the lower arch, then that's going to determine what mouthpiece I'm going to use. If I'm working on tooth number 18, tooth number 19, 31, 32, 30, 31, 32, any of those posterior molars on the lower arch, I want to use a mouthpiece that's called the DV mouthpiece, the medium DV. That has a deeper vestibule that goes straight down into the lingual aspect and the lingual vault right down there. And it keeps the tongue out of the way, and it keeps the sublingual gland from popping up and us nicking it with the burr. The last thing we ever want to do is nick that sublingual gland. You do it once in your entire dental career and you never want to do it again. How do I know? I did it. God, I was 25, 26 years old. I was doing an occlusal filling and I got over to the lingual somehow. Man, that little bird just nicked it and it opened up. It must have opened up, 2 centimeters, a cut 2 centimeters long. I panicked like heck, but I got my cool back. I stitched it together and it was fine. So protect that area at all costs. So back on track now. Choose the right size mouthpiece. Look in the mouth, see where we're working. And if we're working on those lower molars where we have a lot of difficult access, a medium DV is the way to go. Now, how do I create more access when there's just not enough room? One of the ways to do this is to actually take the mouthpiece and from an anterior aspect, if it's forward, actually push it back as far as you can get it. By pushing it back as far as you can get it and resting it on the molars over here, that's automatically going to open up the lateral width. So you'll actually, by moving it back, you will open up the lateral dimension. That will give you room for your handpiece. That's number one. The second thing that we can do right here is to put a little Vaseline on the head of your handpiece, on the back side of the handpiece. And if you do that, that will actually, so like right back here, you can actually slide the handpiece along the lingual surface of the Isolite mouthpiece. That's a second trick that we can do. When we have to do occlusal reduction and we're using a diamond, a donut diamond burr, then another thing that we can do is we turn the handpiece sideways, and instead of coming from the lingual like this, where we're going to bounce into the mouthpiece, we actually come from the buccal. That's another thing that we can do. And then the fourth thing that we do, we were taught in dental school, as we hold a handpiece in a pen grasp like that, we want to hold it up really close to the head of the handpiece for control. Back it off a bit. hold it back here. That'll give your handpiece a little bit more room in the mouth. And then you can also use a fourth finger rest on the outside of the mouthpiece. I'm going to try and do this here. This is the Isolite mouthpiece. You can actually rest outside the mouth on the mouthpiece just like that. And so you can use that as a fourth finger rest. That will also give you more room.
That is awesome. Thank you for that. So medium DV mouthpiece, that gives you a little more room because of the orientation inside the mouth. You can push the mouthpiece back one tooth towards the posterior, and it gives you more space.
Yeah.
Hold the handpiece a little bit off to give you a little more space. Now, Dr. Hirsch, you mentioned once about...
Go ahead, because I'm going to mention that right now because I know where you're going.
Go ahead.
Okay.
Awesome.
So sometimes we get these things, and less is actually more. You know, less is more. So we go in here, and sometimes we need to get the patient closed down. Where we think we need them open for more room, we don't. We actually need to close them down to get more room. So by closing them down, sometimes I will use a small mouthpiece or an extra small mouthpiece. Kind of a nice thing about this extra small mouthpiece is the pocket area right in here is deeper, and that will give us more room in itself. It will also with this mouthpiece, it will allow lateral shifting of the jaw. So if you're working on the left-hand side, they can actually shift to the left or the right, and that will give us more room also. So less is more. A smaller mouthpiece sometimes works better than a larger mouthpiece to create more room.
And which smaller mouthpiece would you suggest for, I mean, can you actually use a pediatric or an extra small in an adult?
You really can. I mean, as strange as it may seem, we were taught way back when, get a big bite block in here because a large bite block is going to give us a lot of room. But the mouthpiece that I use here that I've really found to be kind of fun using is the extra small or the new pediatric mouthpiece. It's got this deep pocket. If we compare this to two mouthpieces, I'm going to try and get this just right. You can actually see the depth of the pocket. I believe. Yeah, there we go.
Yeah, you can. You can
see the depth of this pocket over here, and it's just deeper, and there's just more working room with the smaller mouthpiece.
Awesome. The other thing that you'd mentioned to me is by closing the mouth slightly, you're not stretching the mouth, and it's easier to retract. Or
exactly, when you're at a smaller vertical dimension, then the cheeks are a lot more relaxed. They're a lot looser, and you can just, I'm not sticking my fingers in my mouth right now, but with a mouthpiece, with a handpiece, there's more laxity in the cheeks like that than when you're open wide. When you're open wide, the muscles so tight you just can't do it. So closed dimension, less is more.
Awesome. And then there was one more thing that you had mentioned to me before, and I'd love for you to speak about it. When the actual mouthpiece is inside the mouth, because there's a lot of room, you can actually push on the actual mouthpiece towards the throat. Could you explain that, please?
Sure. That's what I was talking about when we were putting Vaseline on the head of this. So you can actually take the mouthpiece. I don't have any Vaseline right here, but you can actually take the mouthpiece and push the Isolite mouthpiece out of the way with the head of your handpiece. By Vaselining that, it really allows it to slide along here perfectly. A lot of times when we're working in an area, we don't have enough room for the mouth mirror, our handpiece, our own visibility, or the Isolite mouthpiece. There's just not enough room in the mouth sometimes. And sometimes we're doing things blind. And when you're doing things blind, let's say we're working on the distal of number 15, then we're doing a full crown on 15, and we can't see behind the back of that thing. And if the Isolite mouthpiece is there, the nice thing about that mouthpiece is if it's at 15, you can actually push the handpiece back against the mouthpiece. That pushes the tissue out of the way, so you're not cutting the cheek anymore. You know, there's not a dentist out there that hasn't cut a cheek, and I've cut more than my share of cheeks in my experience in my lifetime. This protects. I'm going to try something here. I don't know how well this is going to work on camera because I haven't done it, but let's give this a go. A medium mouthpiece here. Okay. And not so well. It doesn't show so well. But the medium mouthpiece will just go ahead and you can push against here, and that will actually push the mouthpiece out of the way and push the cheek out of the way. It just gives us more room. I hope
Awesome.
that, even though I couldn't show it very well, I hope it explained it better.
No, that's it. So, Dr. Hirsch, Dr. Tom, thank you so much. Medium DV, use a smaller mouthpiece, close the mouth. You can push it in and around, retract. Hey, folks, if you enjoy this or if there are other questions, please feel free to run them by us. Next week, we're going to cover another. Send us the questions that you have. Let us know, and we'll have Dr. Hirsch take us through additional tips and tricks with Tom. Thank you so much, sir. Appreciate it. Have a wonderful week. And again, please be safe and hope everything is well.
Thanks, Rolando. Everybody be safe out there. One last little bit of advice with this COVID-19 thing. Bring your staff in, train for a day, go through a day with your staff as patients, as emergencies. Let them go ahead and do a dry run. If you're doing a dry run through this whole COVID thing, when your actually patients come back in, you're going to be prepared for what you have to do.
I love
Take
that.
care, everybody.
Thank you so much. Appreciate it. Take care, everybody. If you like this, please share. Let us know what other additional tips and tricks you're looking for, and we look forward to updating you again. Take care, sir.
Bye now.